expansion into new indications. So this is the other real big thrust behind market growth that we're seeing in our models. We're seeing more devices branching out beyond these sort of traditional areas of chronic pain management, movement disorder management. Uh, we're seeing devices being applied in novel ways to take advantage of the fact that at our core, there's electricity running through everybody's body, and we can regulate that electricity with these types of devices to modulate the way that certain diseases respond and how they can kind of be better managed with a more appropriate electrical stimulation and modulation. Some of the areas that we're seeing that are particularly exciting is in obesity. With 1 billion patients worldwide, early research is suggesting that neuromodulation could play a significant role, as well as being a combination therapy with GLP-1s and helping patients manage their weight loss. Psychiatric conditions. Historically, the psychiatric conditions that have been managed uh, by neuromodulation devices that are currently on the market are quite small. The number of patients there that you can target are limited. But looking into conditions like PTSD, depression, um, other psychiatric conditions that have a much wider population of patients that can be served is going to, and tailoring devices that can treat these conditions is going to be a massive uplift for this market. Autoimmune diseases is one that particularly excites me, and we'll talk about one of those companies in this space. But it goes back to kind of the core benefit of neuromodulation, which is getting patients off of pharmaceuticals. And for those that don't even respond to pharmaceuticals, providing them with a way to manage their disease. So autoimmune diseases are a very exciting application for neuromodulation that we're looking forward to seeing these technologies begin to break into the market. Pediatrics is another area that would broaden new patient populations, but I think it goes back to one of the earlier comments I made on the longevity of devices. In order to get these devices into peds, you need to figure out a way to prevent having repeat surgeries over the patient's lifetime.